So, very good morning, good afternoon, good evening, everyone. So, we are discussing about, I am just checking your syllabus. So, as per your syllabus, particularly in Unit 4, there is a pharmacology of the drugs acting on endocrine systems. So, in this one, we have already covered this part, oral hypoglycemic agents, right? Insulin and glucagon. So we have covered this, but we have not discussed about this part, first part, that is a basic concept in endocrine pharmacology. So now in this videos, I am going to explain you about what are the basic concepts in the endocrine pharmacology, right? So what are the basic concepts in the endocrine pharmacology? I am just going to share the whiteboard. Need to take a little bit time. Yeah. So, endocrine pharmacology, basic concepts in the endocrine pharmacology. What are the important points? First thing is, it's understood that it's the pharmacology with respect to endocrine systems. So, when we talk about endocrines, so we are talk about hormones. So, what are hormones? Hormones are the substances which are produced by the specific cells in the body and act away from their site of productions. So hormones are released by specialized cells in the body. For example, this is a specialized cells. Hormone is released by these cells, and these hormones will act on the other cells in the bodies. So it might be act on here, right? These are the hormones which are synthesized and released by this particular specific type of cells in the body. And these chemicals, these hormones are showing their response by acting on other cells. So they have a receptors on the other cells in the bodies, and then you are getting the response. These are the hormones. So that is comes under endocrine pharmacology, right? So in endocrine pharmacology, when we talk about hormones, so there is a hypothalamus. Hypothalamus is attached with your pituitary glands, right? Pituitary is your anterior pituitaries and one is your posterior pituitary, right? So this is your hypothalamus, 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 and it's attached with your pituitary glands. So, uh, right type, sorry, pituitary. These are your pituitary glands, right? Pituitary, pituitary, right? So as I said, pituitary is of two types, anterior and posterior pituitary. And whenever any signals comes, so what happens? So whenever there is a signals, so signals will goes to the hypothalamus. Any signal, for example, your thyroid hormones level is decreased, right? Hypothyroidism. So signal will goes to the brain. Brain will going to hypothalamus is going to release some hormones, and that hormone is going to stimulate the cells in the pituitary. So pituitary gland, anterior and posterior pituitary have a specialized cells. Okay, so they have a specialized cells, and whenever any stimulus, as I said, for example, stimulus is decrease in thyroid hormones. So decrease in thyroid hormone is going to stimulate your hypothalamus. So hypothalamus is going to release one hormones that we call CRH, TRH, thyroid releasing hormones in this case. TRH. These thyroid releasing hormones will act on the anterior pituitary because anterior pituitary have a cells of the thyroids and that cells we call thyrotropes. So, in anterior pituitaries, there are a different types of cells. Starting from, we can start with the somatotrophs, right? There is a thyrotrophs, thyrotrophs. There is a corticotrophs. There is a gonadotrophs, right? So there are a different types of cells in the anterior pituitary. Somatotrophs, thyrotrophs, corticotrophs, gonadotrophs, and if we talk about posterior pituitaries, it contains posterior pituitaries contains, they do the oxytocin, and there is a vasopressin. So we talk about anterior pituitary first. So as I said, for examples in your bodies, thyroid hormone level is decreased. For this is your blood circulations, and in the blood circulations, your thyroid hormone is level is decreased. Okay, thyroid hormone like T3, T4, their level is decreased. So signal will goes to the brain. This is your hypothalamus, and in response to it, decreased level of thyroid hormone. Hypothalamus will release thyroid releasing hormone, and thyroid releasing hormone is going to stimulate thyrotrophs in the anterior pituitary. Thyrotrophs. And these thyrotrophs will be released, reach in the blood circulations, and through the bloods, it's going to reach to the thyroid glands. And in the thyroid gland, it's going to do the means activate the synthesis and release of thyroid hormones, that is your T3 and T4 hormones, and your homeostasis will be maintained. This is simple, just one examples. Like that, there is a somatotrophs. Somatotrophs are your growth hormones. Somatotrophs are the cells which do the synthesis and release of growth hormone. These all are the cells, the somatotrophs, thyrotrophs, corticotrophs, gonadotrophs. So for examples, in your blood circulations, or your growth is decrease, means your growth is not up to the mark. So what happens, the signals will goes to the brain, and in response to that, hypothalamus will release one hormones, and that is the growth hormone releasing hormone that we call GHRH. GHRH, growth hormone releasing hormones, that is released by the hypothalamus. Now this growth hormone releasing hormone is going to act on somatotrophs. So these somatotrophs will do the synthesis and release of growth hormones, and these growth hormone will reach in the systemic circulations, act on target cells and target tissues, and do the growth of particular cells, right? Like that, there is a corticotrophs. So when corticotrophs concentrations is decreased, means your ACTH, corticotrophs are the cells which do the synthesis and release of ACTH. So ACTH, for example, synthesis is decreased, or then it do the stimulations of hypothalamus in response to that, it's going to release so CRH, corticotropin releasing hormone. Here is a, like in case of thyroid, there is a TRH, there is a CRH, corticotropin releasing hormones. So corticotropin releasing hormones will act on the anterior pituitaries and stimulate the corticotrophs. And corticotrophs is going to release ACTH. These corticotrophs is going to release the ACTH, right? Corticotropin hormones, ACTH. Right. So like that, particularly for the gonadotropes, so there is a gonadotropes releasing hormones. So these gonadotropes releasing hormones stimulate the gonadotropes and do the synthesis and release of two hormones, that is your LH and FSH. LH is your luteinizing hormones. FSH is your follicle stimulating hormone. FSH, right? LH and FSH by the gonadotrophs. Okay. So, when we talk about one by one, we will discuss, but this is a basic of endocrinopharmacology. So again, I'm repeating hypothalamus. Hypothalamus is, for example, first we are talking about growth hormone. Let me talk about growth hormones, somatotrophs. So, from hypothalamus, what is going to release? GHRH. GHRH is growth hormone releasing hormones, and these growth hormone releasing hormone is going to stimulate somatotrophs. And where is the somatotrophs? Somatotrophs is in the anterior pituitary, right? And these somatotrophs will release the growth hormones, and these growth hormones reach in the blood circulations and act on the target organs. So, there are a conditions in which, so your growth hormones levels can be increased or can be decreased. It should be in the normal levels. But if growth hormones, growth hormone level is increased much more from its normal level, so that conditions we called acromegaly, right? So growth hormones, if it's increased from its normal levels, so that we call acromegaly. And growth hormone, if its level is decreased from its normal values, so that we call dwarfisms, right? So, for these conditions, when your growth hormones level is decreased, so what you have to give the treatment? You have to give the growth hormone analogs. Like, so we have a recombinant growth hormones, like the drugs which we are giving, particularly for management of the dwarfisms, growth hormone when level is decreased, the drug is somatropin. These are the recombinant growth hormones. There is a somatotropin, right? There is a drugs like sermorelin. There is a hexarelin. So these are all are useful in these conditions where growth hormone level is decreased. You have to remember few of them. If question is asked, if there is a means what are the treatments when there is a growth hormone level is decreased or this particular conditions. So these are the drugs: somatotropins, sermorelin, hexarelin, and these all are recombinant growth hormones analogs, right? And another conditions for this conditions, acromegaly, when your growth hormone level is much more increased. So in that conditions, you need growth hormone antagonist, right? So growth hormone antagonist, the drugs are growth hormone antagonists. Antagonist. Growth hormone antagonist, one of the drug is pre PEGRISOMANT. Pregisomant. This is the growth hormone antagonist. There is a somatostatin. Somatostatin is your growth hormones antagonist, and particularly its duration is short. So so we have scientists have created a longer acting growth hormone antagonist. Drugs are OCTRE, OTIDE, octreotide. I think it's maybe not visible to you. Yeah, now, right? Then there is another drugs which are the antagonists are LANREOTIDE. There is a SEGLITIDE, seglitide, right? lenalidomide. So these all are the drugs which are the growth hormone antagonist and useful in the conditions acromegaly, where your growth hormone concentration is much more, right? When your growth hormones concentration is decreased, for that one you need a analogs, and analogs are these one: somatotropin, sermorelin, hexarelin, somatrim. These are the analogs which are useful in these conditions where growth hormone concentration is decreased, and these are the drugs which are useful when your growth hormones concentration is much more from its normal values, right? So like that, this is your growth hormones. Then we will discuss thyroids hormones as well. So thyroids, so first you have to be understands how these are synthesized. So I am going for the next page. Yeah. So thyroids, as I said, again, there is a your hypothalamus, right? There is a pituitary, particularly we are talking about anterior pituitary. And anterior pituitary, we are talking about specialized cells which are responsible for thyroid is thyro, thyrotrophs, thyrotrophs. So there is a TRH which is released by the hypothalamus when thyroid hormone level is decreased. So these thyroid releasing hormone is released, and this TRH is act on the thyrotrophs which are there in the anterior pituitary, right? So this thyrotroph is going to release thyroid stimulating hormone that we call TSH, TSH, TSH. This TSH is going to stimulate the biosynthesis of your thyroid hormones. So in thyroid gland, so this is your, for example, thyroid gland. Okay. Thyroid gland is your butterfly shape. So don't be confused. It's not square. Just for understanding, I'm just putting like this. So, so how these T3, T4 is biosynthesized in the thyroid. So there is a follicular and parafollicular cells are there. So follicular cells are particularly responsible for the synthesis of T3 and T4. So first there is a transporters for sodium and iodide. So sodium, and this is importers. Importers, if you remember, I told you already as well. Importer means एक ही डायरेक्शन में मूवमेंट होगी. तो सोडियम भी अंदर जा रहा है और आयोडीन भी. Iodine contains negative charge, right? So negatives and your proteins are also negative. So they are not going to combine with each other. So what happen in the first step is it's going to be oxidized. So this iodine is going to be oxidized and oxidized to your I positive ions. So first step is oxidation, by which your this iodine, these negative ions is converted into the positive ions, and then now they are going to be combined with the tyrosine residue of thyroglobulin. So thyroglobulin is a proteins, right? So these positive ions is going to combine with what? Going to combine with tyrosine residue of thyroglobulin, right? So it's going to be combined. I'm putting plus sign. So your I positive ions is going to combine with tyrosine residue of thyroglobulin and going to do the formations of your monoiodotyrosines or diiodotyrosines. Mono, that we called MIT, we call it monoiodotyrosines, or DIT, diiodo. tyrosines. And these monoiodotyrosines or diiodotyrosines, so there are a number of molecules will be formed, MIT, MIT, DIT, DIT. So when MIT will combine with DIT, it will form the T3 hormones that we call triiodo, right? And when it combines with DIT plus DIT, when two DIT combines, then it will makes T4 hormones, T4 tetraido, right? So T3 when MIT combined with DIT, when two DIT molecule combine together, it will make T4, right? And this reactions we call coupling. So first reaction is oxidations. Second reaction is your organifications. Organification is this one, the combination of these two. This is the second step. First step is oxidation. Second step is, I can write the step. This is the second step where I positive ions is combining with the tyrosine residue of thyroglobulin that we called organifications. Organifications, right? Organifications. And now when your MIT plus DIT or DIT plus DIT, these kind of reactions we call coupling reactions. There are three types of reactions, your oxidations, organifications, and coupling. So these T3 and T4 will be biosynthesized and they are going to store inside the vesicles, right? They are going to store inside the vesicles in the thyroid glands. Whenever there is a stimulus, these T3, T4 is going to be released, right? Whenever there is a stimulus. So, depending upon the, if someone is suffering from hypothyroidism, so you have to give these T3, T4 hormones, levothyroxines, when if someone is suffering from hyperthyroidism, whose T3, T4 level is much more hyperthyroidism, so you have to see the drugs which are blocking somewhere in these pathways. So we have a drugs, so for the hyperthyroidism, drugs for the hyper, because for hyper you want less biosynthesis of T3 and T4, right? So we have a drugs which are blocking here, importers, but currently we are not using these drugs due to their toxicities. The drugs are, thiocyanate, fluorate, perchlorate. We will discuss in the, I think, next videos what are the drugs which are useful for the hyperthyroidism. But when we talk about hypothyroidism, the drugs are levothyroxines. You have to give analogs of these hormones, right? So you have a levothyroxines that we called T3, T4 is thyroxine. So if there is a T4 deficiency, you can give thyroxine and levothyronin. Levothyronin is T3, levothyronin, right? So I am stopping here. In next videos, we'll cover about drugs which are useful for the hyperthyroidism. Okay, thank you.